everyone. Now, as most of our IPA patient has this query of how the egg retrieval is done, whether it is painful or they need a overnight stay in the hospital. So to answer this, I'll give you brief about the egg retrieval. Now, when we do the follicular monitoring and when the follicle size reaches 17 to 18 millimeter in size, the trigger injection is given, and usually after the 36 hours of the trigger injection, the egg retrieval is done. So for egg retrieval, the patient is called fasting because it is done under general anesthesia, and it's a short procedure, daycare procedure, where there is no cut, no stitch. The procedure is done under ultrasound guidance, and the same transvaginal probe is introduced through the vagina. With the probe, the needle is introduced through the vagina, and the fluid of the follicle aspirated one by one. And this fluid, which is collected in the tube, is handed over to the embryologist to check for the eggs in the fluid. And once the eggs are collected, after few hours, they are denuded, and then the same day, the husband is asked to give the semen sample. The sample is centrifuged, and the healthy, normal looking sperm is selected. It is taken into the pipette and is injected inside the egg to improve the chances of fertilization. And next day, the fertilization status is checked. So it's a simple procedure, but it has to be done by the specialist to prevent the complications of it. And the patient is discharged 2 hours after the procedure with all the instructions which are given by the doctor. They have to be followed, which are usually the antibiotics, a painkiller, and some hormonal support if the embryo transfer is also planned in the same cycle. Thank you so much.